Ambulance and emergency care. Introduction to the module. The goals of first aid include saving lives, avoiding further harm, assisting in recovery, reducing pain, and safeguarding the unconscious. The primary goal is to save lives. If correctly administered, first aid training is critical to doing this. It provides you with tools to keep the problem from worsening. It also learns to avoid doing things that are needless in a crucial scenario. You can stabilize a patient until emergency medical personnel come if you can administer basic treatment. As a result, it can meet certain fundamental life-saving standards. At the completion of the module, you will get to know about the basics of first aid techniques. Topics to be covered: the survival chain, basic first aid do's and don'ts, how should face shields be used, how to apply a dressing, how to apply a bandage, how to wrap a hand, saving someone from water and fire. Summary. The survival chain. Early identification of sudden cardiac arrest and access to emergency medical treatment, early CPR, early defibrillation, early advanced cardiac life support, and physical and mental recovery are the 6 interdependent links in the chain of survival. Sudden cardiac arrest occurs when the heart suddenly stops beating without any earlier warning signs such as chest discomfort or shortness of breath. It can be lethal very rapidly. The statistics support up this fear. 95% of SCA patients die before reaching the hospital. Did you know that this number may be drastically decreased, to the point where the survival rate can reach 75%? The chain of survival comes into play here. Each segment of the survival chain is inextricably linked to the next. 4 main steps. The survival chain. Early access. Recognizing a cardiac arrest is the first step. Some people do not realize the gravity of the situation until it is too late. A first aid training can teach you how to spot this in a victim by thoroughly monitoring their respiration and alertness. Once it is determined that the victim is unconscious and not breathing, an ambulance should be sent right once to ensure that defibrillation and life support arrive as soon as feasible. Early CPR. CPR can keep crucial organs including the brain oxygenated if it begins within 4 minutes of the heart stopping. This is a useful technique for onlookers to assist in keeping someone alive until better tools arrive. CPR helps to pump blood and oxygen around the body until an automated external defibrillator or aid arrives, with a ratio of 30 chest compressions to 2 breaths. And you don't have to do breaths to keep the victim alive. Early defibrillation. There is a considerably enhanced survival rate if CPR is administered within 4 minutes and defibrillation is administered within 8 to 12 minutes. Every minute when defibrillation is not used diminishes the odds of survival by 9%. A defibrillator will shock the heart back into motion, and the greatest part is that they give audio instructions on how to use them. Early advanced life support. Medical care, such as medicine and airway stabilization, will raise the chances of survival even more. The victim will require hospitalization for proper treatment and monitoring to guarantee their long-term health and well-being. Basic first aid do's and don'ts. Do's. Attend to the casualty as soon as possible. While providing first aid, make the casualty comfortable. Transport a lower jaw fracture victim in a seated position with their face down. Stop the bleeding. On-the-spot fracture analysis and treatment. If in doubt, treat the wounded for a fracture. If you are vomiting, tilt your head to one side. Causality with fractures of the pelvis, leg, or spine must be elevated simply using a blanket lift. If you're using a constrictive bandage, make sure to relax it every 10 to 15 seconds. Don'ts. You are not a doctor. Thus, do not assume too many obligations as a certified medical professional. Never attempt to realign a displaced point. Never use a bandage that is excessively tight to prevent blood circulation. Never ignore rat, monkey, bug, or dog bites. If the victim is unconscious, do not provoke vomiting. Never provide a key bunch, iron piece, or blunt, sharp materials to an epileptic fit victim. If you suspect an internal injury, do not feed the person. Basic first aid do's and don'ts. How should face shields be used? Face shields are often made from a clear screen, or visor, and an adjustable head strap. The screen bends around the face and extends below the chin, preventing infectious droplets from entering the eyes, nose, and mouth. Face shields, as opposed to face masks, are typically see-through and cover the full face. Face shields of various types. Among their distinctive functions and traits are the following: anti-fog, anti-splash, anti-static treatment, anti-scratch, distortion-free, lightweight, optically clear. The forehead band should be about 3 centimeters above your brows, with the shield's bottom about below chin level. You must constantly keep your shield down. The shield should never be pushed all the way up. If your visor does not remain in place, tighten it by tightening the elastic on the face shield side. How to apply a dressing. Before applying any dressing, wash and dry your hands, and if available, wear disposable medical gloves. Also, if you're assisting someone else, inform them what you're doing as you apply the dressing and ask them to sit or lie down. Stop any bleeding by exerting pressure and elevating the injured limb or arm above the level of the heart. Use a dressing that is somewhat larger than the wound to be covered. Hold the dressing at the margins with your fingertips away from the section that will cover the wound. Bandages with sterile dressing pads. Dressing pads that are sterile come in a protective covering. They are no longer sanitary once removed from the wrapper. When using one, hold the bandage on each side of the pad and clean and dry the wound and surrounding skin. Position the pad directly on the wound. Wind the short end once around the limb and the pad once around the limb to cover the entire pad. Tie the ends of the pad together to secure it, and apply gentle pressure to the wound. How to apply a bandage. Different bandages are required for different injuries. Some examples of bandages are bandages for compression. These bandages, also known as elastic roller bandages or crepe bandages, consist of a long strip of stretchy cloth packed in a tight roll. After injuries such as sprains and strains, compression bandages are used to support the bones, joints, and connective tissues in the hand. Bandages made of gauze. Gauze bandages are dressings rather than bandages. A gauze dressing is a thick cotton pad used to cover wounds ranging in size from medium to big. Tape or a roller bandage can be used to keep them in place. Cotton, linen roller bandages. These bandages, like compression bandages, come on a roll. They are commonly used to keep gauze dressings in place. Adhesive, plaster bandages. These are wound dressings that are similar to gauze bandages. One brand is Band-Aid. They come in various sizes for tiny wounds and contain an adhesive to adhere to the skin. Bandages in tubular form. Tubular bandages are elastic bandages that are tube-shaped and meant to go around the fingers, elbows, or other regions of the body that move a lot. They can be used to give support or to hold gauze dressings in place. Triangular bandages. These cotton bandages are flexible and handy for first aid. They can be used to create a sling or to provide pressure to a bleeding wound. The following are the most important considerations while putting a bandage. Make sure the individual is comfortable and explain what you're doing. Work from the side of the injury to avoid having to bend across their body. Keep the damaged portion of the body maintained in the posture it will be in when the bandage is applied. Use the appropriate size bandage. Various sections of the body require different bandage widths. When bandaging a limb, avoid covering fingers or toes so that you may quickly check the circulation. Apply the bandage firmly but not tightly, and then bind the end by folding it over and making a knot. A safety pin, tape, or bandage clip can also be used. How to wrap a hand. Here are some examples of common hand injuries that may necessitate bandaging, as well as warning indications that you should seek medical attention. Fracture. A hand fracture happens when one or more of the bones in your hand are broken. A boxer's fracture is the most frequent type of hand fracture, which happens when one of the bones at the base of your knuckles, where the fingers meet the hand, breaks. The following are some frequent indications and symptoms of a hand fracture. Your hand's bone is plainly twisted or misshapen. You can't move your hand or fingers because it's bruised, sensitive, and swollen. Your fingers or hand are numb. Even with over-the-counter pain relievers, the discomfort is excruciating. When to use a bandage. A bandage can be used in place of a splint or a cast to limit the movement of a fractured hand or finger. Sprain. A hand sprain is an injury that happens when a ligament, which is the tissue that joins the bones in your hand, is stretched or torn. When to seek medical help. Sprains are seldom medical emergencies, although they do need medical attention. If the pain or swelling in your hand worsens, you should consult a doctor. When to apply a bandage. A compression bandage might assist in keeping pressure on the sprained region. This reduces swelling by avoiding fluid accumulation at the location of the sprain, allowing your hand to recover more quickly. Strain. A hand strain happens when the muscles or tendons in your hand are stretched or torn. Injuries to the tendons that link the wrist and forearm muscles to the fingers are frequent. When to seek medical attention. Muscle strains, like sprains, are not considered medical emergencies. However, you should see a doctor to determine the reason of your discomfort. When to apply a bandage. A compression bandage, like with a sprain, will aid to immobilize the wounded region and maintain pressure. When to seek medical attention. Many small hand wounds heal on their own. Keep in mind that your hands have a lot of nerve endings, tendons, and blood vessels in a tiny space. Even a little hand wound might cause significant harm. When to use a bandage. After cleaning a small lesion, apply antibiotic ointment and wrap it with gauze. Use a plaster if the wound is tiny. Saving someone from water and fire. Lean over the victim with your arms straight. Press down forcefully for around 5 to 6 centimeters before releasing the pressure and allowing the chest to rise again. Compression should be done at a pace of 100 to 120 compressions per minute. Give no rescue breaths. Saving someone from drowning and burning. To follow some steps. Seek assistance. If a lifeguard is nearby, notify them. Person should be moved. Remove the individual from the water. Examine your breathing. Position your ear near the person's lips and nose. Check the pulse if the person isn't breathing. Start CPR if there is no pulse. If the person is still not breathing, repeat the procedure. Summary. First aid is when you give basic medical care to someone who has suffered a sudden accident or sickness. In certain circumstances, first aid refers to the initial assistance given to someone amid a medical emergency. This assistance may help them live until expert assistance comes. This lesson explains which actions may and cannot be taken in an emergency circumstance. This session will go through several sorts of first aid techniques. Finally, we'll go through several life-saving techniques. It must be beneficial to anybody who attends the critical thinking situation.